Hello, I'm Dr. Ron Lewis from Skin Doctor SA in Adelaide. And I'd like to demonstrate the removal of moles cosmetically using radio wave technology. With the radio wave technique, we use fine wire electrodes putting out high energy radio waves, and we use those wires to just gently cut through tissue and shave it away. So moles can be removed simply by shaving them down to skin level, after which they form a crust or a scab which peels off after a week or so, leaving a pink patch. The pink patch then takes the same as any other scab, that is, it takes a month or two for the colour to come back to normal. One of the advantages of removing moles with radio waves is that there's no need to touch the surrounding skin. You are simply touching and wiping away the mole tissue. You contrast that with the excision of a mole. There's always a margin of normal skin taken, and then when the skin is pulled together and sutured, the scar is usually larger than the original lesion, whereas because you're just shaving the mole down to skin level, the little scab that remains when you finish the procedure is the same size as the mole itself and no bigger. And so the pink mark after a week or so when the scab comes off is the same size as the mole. The radio laser mole removal procedure is totally painless because we always inject them with local anaesthetic first, just a drop under the skin, and it becomes totally painless. There's usually no regrowth of moles. Occasionally it happens, but if that is the case, you just have a touch-up after 6 to 8 weeks, but it rarely happens. One problem that can arise with pigmented moles is that when you shave them down to skin level, there can still be some pigment present, and you don't want to go shaving deeper to try and get all the pigment. So you leave it, and when it heals, you may have a little bit of pigment incorporated into the healed area. And if that is the case, well, you can simply remove that at a later stage with laser. Because Skin Doctor SA also has the dual yellow laser, we can provide that aftercare, whereas many other mole removal clinics don't have that service. One thing always to bear in mind with mole removal is that you should never have any mole lasered off or radio lased off without it being checked out first by a doctor who's experienced in skin cancer and melanoma medicine, because you don't want to be partially removing what is in fact a cancer. So at this clinic, all moles are checked dermoscopically, and if there is any doubt, we don't proceed. We would biopsy or excise them or monitor them.